The BioSure HIV self-test allows you to discreetly determine your status in private, in a place and at a time that is convenient to you. Your test will be discreetly delivered by post in plain packaging. It's best to perform the test somewhere where you feel comfortable and relaxed. You'll need some way of timing 15 minutes. It's really important you read and follow the instructions carefully. When you're ready to test, tear open the foil pouch. You'll find your test device, a safety lancet, and a plaster. There is a small buffer pot in the end of your device. Take this out and place it in the hole in the box. Now take the lancet and remove the cap. It doesn't matter which finger you get the drop of blood from. Place the red pad of the lancet onto your finger and push down until you hear a click. If necessary, you can squeeze your finger to make the drop of blood. Simply touch the tip of your test device onto the drop of blood. It will automatically collect the right amount. Now, firmly push the tip of your device through the foil on the top of the buffer pot. It needs to go right to the bottom to start your test running. Start timing 15 minutes. After about 3 minutes, check to make sure the colour is slowly moving upwards. If it's not, you need to make sure your device is pushed right to the bottom of the pot. After 15 minutes, open your result booklet. This explains exactly how to read your result. Place your finished test in the cutout space in the box. Read through the booklet, comparing your test to the images on each page. You need to make sure the top line, the control line, is visible, as this means your test has been performed correctly. If this is the only line visible, your test result is negative. If you can see 2 lines on your test, even if the line underneath is faint, your test result is positive. If your test does not look like either of these, or there are no lines, your test has not worked. You need to perform another test. If you do get a positive result from your test, the first thing is don't panic. Your BioSure HIV self-test is extremely accurate, but you must have your result confirmed by a healthcare professional. If your test is negative, don't put yourself at risk based on this result. Condoms are the easiest and safest way to protect your own and others' sexual health. Choose to stay negative. If you make choices that put you at increased risk of HIV infection, it is recommended you repeat the test every 3 months. When you've finished your test, you can put everything back into the box and place it into the opaque disposal bag provided. This can then be sealed and thrown away with your normal rubbish. Please remember your test may not detect HIV infections that have occurred within the last 3 months. Thank you for using BioSure HIV self-test. Remember, HIV is just 3 letters. It's not a sentence.